I'm Carly Kramer. I'm the founder of Beekeepers Naturals, and this is the science of fertility. Let's get into it. This episode, we are answering all of your questions, and we got some incredible questions on everything. We're going to be covering everything from what supplements to take to PCOS to
endometriosis.
Yep, endometriosis came through, cycle, understanding your cycle, partners, fertility, all the stuff. So we have some amazing questions and obviously an amazing expert. So let's get into it.
Amazing.
The first question I have in front of me. Best advice for a mom with PCOS after having kids. And she is saying that it seems worse, her PCOS, than pre-kids.
Not uncommon that I hear that, unfortunately. Firstly, my heart goes out to you. And this is also proof in the pudding of, I think a question that comes through later. We can get pregnant and have healthy babies on PCOS.
A lot of people asked, can I get pregnant if I have PCOS? So
yes, which we'll come to in a moment. But yes, great testament to that. My biggest piece of advice is, if you haven't already, get a nice comprehensive blood panel done and really look at where your hormonal health is sitting, because pregnancy can shift so many things in our body. It can create insulin resistance if that wasn't there before. Maybe that's now a factor that hasn't been. Maybe we're not producing as much progesterone as we were previously. Maybe we're having anovulatory cycles, meaning we're not ovulating anymore. A lot of these things we can get answers to from a little bit more comprehensive blood work. And so if you haven't listened back to our episode on labs and blood work, where we dive a lot more into the complexities of that, there's some resources there as well. But that would be my biggest piece of advice. So all of those markers that
we spoke about, someone with PCOS, would that be the ideal things to explore? Is there any additional ones for someone with PCOS?
Other additional ones would be, which could be similar for others, but inflammatory markers, because when we have states of insulin resistance, we can be more inflamed. So looking at things like high sensitivity, C-reactive protein, or HSCRP, can be super helpful, as well as other markers like homocysteine, which can be a marker of inflammation as well. So just a few other things that you could certainly factor in. But really the biggest thing would be get a good understanding of your ovulatory window if you're ovulating, but really for the purpose of doing that blood work post-ovulation to see, are we making way more estrogen than we need to? Do we need to support the liver and detoxification of those estrogens? Do we need to look at our gut health? Because that can relate to estrogen levels. Do we need to adjust and support our progesterone production in different ways? And I think, again, a lot of those questions can be answered. So it'd be my best piece of advice was really to get a good comprehensive look at all of those so that you know what needs to be addressed and treated and supported instead of just blindly throwing supplements at it. The one caveat I will throw in there is there's a lot of really wonderful research on myo-inositol and D-chiroinositol for PCOS, probably one of the more studied ingredients or supplements that you can get out there. That could be a really wonderful addition. Talk to your healthcare provider if that'd be helpful for you too.
And on the ovarian follicle health, we actually have a question later about a supplement that can really contribute to health there. So
perfect.
Yeah, we'll get to that later. Okay, next question. This is coming from a student athlete. She wants to know, what should her cycle look like? I guess a cycle can look different depending on how active you are. So, and I want to know this too, even though maybe I should know this already, but I want to know, what does a normal cycle look like? What are the days between? Is it different based on activity level?
Great question, and not something that all of us females know, and I think we should. So a normal cycle, quote unquote normal cycle, is between 21 and 35 days. We shouldn't be less than 21 days between bleeds, and we shouldn't be more than 35 days between bleeds. The actual bleeding, which is our period, shouldn't be longer than 7 days total. And then the third part of that is there shouldn't be more than 9 days in variation cycle to cycle, meaning one cycle shouldn't be 20 days and then the next 34 days in length. That can also be a sign that something is off. So whether you are active, not active, in theory, your cycle should still fall within those parameters. However, for athletes, sometimes if we're over-exercising and under-fueling, our body kind of goes into a state where it's fasted because we're just not getting in enough calories and nutrients, and it recognizes that we're not in a place to have a pregnancy, so it's going to adjust and alter our menstrual cycle. So if things were normal and cyclical and flowing well, and they've shifted, great time to look at our nutrition, ensuring that we're getting enough in to support the needs of of us as an athlete, and also a great time to investigate, how well we're managing our stress, because athletes and exercise is a stress on the system. If we're not managing that, that can also have an impact. So that's kind of what a normal cycle should look like.
So everyone really wants to have a normal cycle. And if you don't have a normal cycle, you need to look at nutrition, lifestyle, maybe do some testing.
Yes, yeah, absolutely. Talk to your doctor would really be step one. But in the circumstance of an athlete, like one of the biggest things that comes to mind is nutrition and just the balance of that and exercise.
Amazing. Okay, this next question I love.
Okay.
Because most of the people in my life are getting pregnant after 35. I plan to have a post-35 geriatric pregnancy at some point.
Well, if it makes you feel better, we changed the name to advanced maternal age. So if that helps with anything, we got rid of advanced. We dropped geriatric.
Great. Okay. Yeah. So this study specifically wants more recent studies on fertility after 35 because like many of us, she is haunted by the old, outdated info.
Yes. I want to be optimistic here in saying your age is not the only factor that plays into fertility, but it's also
is biological age a thing? Is that?
Yes, but we're kind of in the infancy of understanding that and testing that. So I say yes, ? Hold for more on that. But when it comes to fertility, we have newer and older, very robust studies that do show there is a decline in ovarian function as we age as females. It sucks to say that. It sucks to hear that. It's unfortunately just our biology as of right now. We're learning more and more that there might be ways that we can halt, slow down, adjust, support, which I think is amazing. But as of right now, we are a lot more fertile and pregnancy can be easier to achieve and maintain when we're younger. I like to share this because I don't think people know this. As females, when we're growing in our mom, we actually have the most eggs at 20 weeks of gestation. We have 6 to 7 million eggs at 20 weeks. By the time we're born, we're down to 1 to 2 million. By the time we hit puberty, we're down to 300 to 500,000. By the time we hit 37 years of age, we have 25,000. And then by the time we hit menopause, which average age in the States is 51 years old, we have about 1,000 eggs left. So there's this progressive decline of ovarian function and what we call atresia. We just lose those eggs. And that gets progressively more exponential later in life as females. So when we hit 35, it's not that it's the end all and be all, but a lot of what I want to say and what I think this podcast is providing is having the knowledge of doing the blood work and getting on a really nice routine, supplement generally, that can help slow down that biological aging process and know that if we're in the advanced maternal age, let's say we're in our 40s, something that's really interesting, if we're in our mid-late 40s, we can have the same ability to have equal live birth rates as our younger counterparts if we use an egg donor. But if we use our own eggs at that age, we have a much higher risk of losing that pregnancy. So it's not that the other parts are dysfunctioning, but it's really that the ovarian health is declining. And so I wish I had more positive light to shed on this, to be totally honest, but I just want to be realistic. And as of right now, we don't have a great way of stopping the clock. And I think it's just having the knowledge of okay, what can I do now? Or how can I adjust my lifestyle, my supplement routine to help optimize ovarian function?
And the good news for everyone listening to this podcast is that there's so much you can do to optimize. We have a whole episode on supplements and lifestyle changes and all the things you can do.
Yep.
And yes, fertility rates have declined, but we're also seeing people, have healthy pregnancies.
Absolutely.
At a different age. And, more and more research is going in that direction. So that's positive.
Yes, totally. And just that we know we have more tools now that we didn't know of last time and in the past, and that our previous episodes highlight of just, we have more that we can dig into and that we can look at and we can lean on to optimize ovarian health, which I think is really cool.
Amazing. Okay, next question. Are there any supplements to start taking a year or two in advance and anything to avoid?
I would say a year and two in advance. I'd honestly focus a lot more on the foundational aspects of life. While yes, I love supplements, I would really say focus on having a really balanced lifestyle. You cannot and you will not out supplement a poor lifestyle, period, full stop. make sure you're being intentional in what you're eating, moving your body, sleep quality, stress management. Those things 1 to 2 years out are going to help build those really healthy natural habits that will get you through pregnancy and postpartum, which will be amazing. If we're talking about kind of like basic supplementation and just wanting ways that we can add in, even if we're eating a whole food-based diet, animal or plant-based protein as well, we can still be deficient in some micronutrients. So having a nice balanced multivitamin, if we don't want to jump into a prenatal, would be wonderful. As well as one thing I'm a huge fan of is omega-3 fatty acids. Even if we're eating fish throughout the week, sometimes we're not getting the quantity that we need. Those omega-3s can be great for a variety of things. And then if we're talking about ways we can just optimize ovarian function, adding in things like royal jelly can be really wonderful, especially for our partners. Give them a nudge. They should be on this journey with you too, because that can help with sperm health as well too. So those would be kind of like a few basic things that we could certainly add in. And then I know previous episode has talked a lot more about supplements. I think as that window approaches and we get to like that 6 month prior to conceiving is really when we can add in the additional nutrients to help support mitochondrial function for both him and her.
And then 3 months is where you really want to start.
Yes. Yeah, exactly. Yeah. 3 months is like the absolute, we're being super diligent 3 months prior, ideally even 6 months beforehand. But I would say 1 or 2 years out, really the foundational lifestyle things are going to outweigh any supplement you could throw down the hatchet.
Did you start your supplement routine 3 months prior to trying or 6?
I started 6 months and then I started additional support for ovarian aging 2, almost 3 years in advance. And that's in particular to me, and as we obviously highlight in the first episode, pertinent to what I experienced. I started that routine 1 to 3 years in advance. I'm trying to think back to like when I was really intentional that I started doing specific things that can help with ovarian aging and or dysfunction. And the reason for that is because I was told I have premature ovarian insufficiency or failure, as we call it. And we talk a lot about that in that first episode, but I was just told I have these ticking time bombs of ovaries and I was not willing to accept that. And so I wanted to start early on.
Which is a beautiful thing to highlight because you were given a diagnosis of ovarian failure, and a diagnosis is not a sentence. And you know, you've started making changes in more of an advanced window, but you had the information, you've done the testing, and you're taking all the right steps. So.
Yeah, exactly.
Amazing. Next question, what supplements should you take to balance hormones? I am going to just open with royal jelly. That's been, you know this, but such a game changer for me for balancing my hormones.
Why I love royal jelly for that and what people maybe don't know is that royal jelly can act on what we call the hypogonadal pituitary axis. And what that means is just the way in which our brain and our gonads, meaning ovaries or testes, talk to each other. And it quite literally can kind of like highlight that communication stream and intensify it so that they're all communicating better with each other, which I think is so amazing. If there's something you can add into your life that maybe you're not already taking or doing that can just improve the way your body's functioning, I think that's so beautiful. And so that's why I love royal. I mean, for a million reasons, but like that's one thing that I really love for royal jelly. The other thing that I will say is if we're talking about balancing hormones, I know that people have a love-hate about that term. What I want to specify is like understand what we're working with, and that's really where the blood work comes in. I'm a very much an objective person where I want to see the data and I want to know like, okay, what's off here and what can we support? Kind of what we were mentioning before, is there way too much estrogen in our system and she needs to quiet and go away? Or is there not enough progesterone? And so getting some information in regards to doing some blood work would kind of help further answer that question.
What would you say a fertility starter pack would include?
If we're just doing kind of like a nice basic, like likely safe for most starter pack, be a nice prenatal would be on there. Omega-3 fatty acid supplementation would be on there. I would also add in royal jelly would be wonderful to have in there, depending on their preference of how they want to get it in. I love our brain health support. If they want to take a little teaspoon of superfood honey, awesome, whatever their preference might be. So you can mix it into tea too.
I
so
do
it's
both.
like, kind of either's an option. And then in addition to that, I would add in also NAC or N-acetylcysteine. Really nice for helping with oxidative stress on the body. So it can help increase glutathione, which is our kind of body's powerful antioxidant. And then the last one would probably be CoQ10 supplementation, just to really like double down on helping with the inflammation, because we just live in an inflamed world. That's just the reality of it. And so anything we can do to help with that can help optimize fertility moving forward.
What can I do now if I intend to conceive in the next 2 to 4 years?
In the next 2 to 4 years, biggest things that I think someone could focus in on is their foundations of health, ensuring that that sleep quality is good, or stress management is top of mind, whether that's yoga, daily movement, or being intentional in the food that we're getting, but also 80-20, like live your life. As I've outed myself on this podcast, previous episodes, I do enjoy sweets every now and then, still enjoy things, but having that balance I think is really important. And then ensuring that if you have a partner now, or maybe not yet, but if you do, that they're with you on this journey and that they understand the role that their fertility plays, because them getting tested earlier is so important. So I think going through it together just really can help expedite the process to having a healthy baby. And then when needed, roughly at least 6 months before, or even 3 months before, we're starting a nice balanced kind of supplement routine catered to what your blood work shows that you need.
Okay, love that. So for all of my younger podcast listeners, what do you do right now if you want to conceive in the next 10 years or 15 years?
Oh, I love that. Absolute best case scenario, I would love if egg freezing could be even more accessible.
Yeah.
I know that we've obviously had our own conversations about it and have our own experiences with it. And I say accessible because I recognize it can be cost prohibitive for many and not often covered by insurance. And the reason that I say that is we're more fertile when we're younger. Your eggs are of better quality. They're doing the most when we're younger. And if we can capture that and freeze that in time and then have that kind of security of like they're waiting for you when you're ready, I think that would be beautiful. But in that process would still be kind of catering your lifestyle to if you were ready to get pregnant then, because that prep really will impact the quality of those eggs as well too. So we don't, as much as like, we all had fun in our 20s, I mean, still have fun now, sure, but we don't want to be having like heavy nights of drinking or like smoking, those sorts of things before an egg freezing cycle, for example. So I would really say what you do today, even if you're in your early 20s, does and can impact you later on. And what I think of is like what could be accumulating over time. And what could be accumulating over time would be things like our exposure environmentally. So things like microplastics in our environment, other toxins in our environment, perfumes, for example, like other things that can be endocrine disrupting, just meaning they interfere with the way in which our endocrine organs work. So any way that we can minimize those now will help kind of preserve your fertility moving forward too, even if we're not pursuing something like egg freezing.
Amazing. I love this question because fertility was so far from my radar in my 20s.
Right.
And for me, as I've gotten older, I mean, I froze my eggs at 29. I wish that was more financially accessible for everyone.
Totally.
And, more a part of the conversation or normalized at an earlier
Couldn't agree
phase.
more. Right.
But I started sort of cleaning up my act using non-toxic products, becoming more aware as I got older. And I think if you can have the awareness, the earlier, the better. And it's just about taking care of yourself. So ladies in your 20s, never too early to take care of yourself. What is something every woman should know about their partner's DNA and fertility?
Oh, that's kind of fun.
There's genetic things there's genetic markers or predispositions that if you overlap, it can be a problem.
Right.
So.
In a perfect world, we have maybe something comparable to like a 23andMe that's done where we can see if we're carriers for different genetic conditions. The reason for that is kind of exactly what you were saying is we get a copy from mom and a copy from dad of our genetic makeup. And so having an idea of like what their part of the equation brings to the table. And then if needed, you can see a genetic counselor to decide like if you proceed with children, what that could look like given like potential risks of carrying certain diseases. So that could be really interesting. And I think that would be really important and helpful information to have. Not necessary, but helpful. What I think would be more pertinent would be a semen analysis, because in that semen analysis, you're getting such a good picture of their fertility and just overall health, truthfully. It's like an outward facing sign of like, is there inflammation? Is there white blood cells in the semen when there shouldn't be? Are things moving? Are things not moving? Are they swimming? Are they swimming in the right direction? Like there's a lot of things that we can gather from that piece of information that can tell us so much about his health. And I think him being with you and being part of that journey is so important, and that being tested earlier. And then again, if that factors in also with some genetic testing that you guys can get done. And I think just having conversations of, what do we know about each other's family history? What conditions do we know or maybe carried? And then from that, you guys can decide if needed, if you want to pursue any genetic testing. Some insurances will cover it, some won't. So I think just conversations to have, with each other and then with your healthcare provider would be awesome.
Solutions for endometriosis. Do we have any solutions for that?
Great question. I feel like we could probably do a whole podcast on endometriosis. I just want to say I am sending so much love to any of my endometriosis warriors that may or may not be listening or watching. I feel for you so much, and that we have let you down in the medical community, period. In all fields. We have sucked at diagnosing you. We have sucked at giving you answers. We have sucked in so many ways. And you've had to become truly your own warriors to advocate for yourself, to get the freaking answers that you deserve. And I just feel so heavily for this community because they've just been so underserved. And I'm saying that because the research is getting there, but it's so much lagging in regards to like what we can do about it. And part of why I care so much is there's this group of like roughly 20 to 30% of couples that are told that they have quote unquote unexplained infertility. And there's been newer research that's shown 80% of those couples have endometriosis, meaning she has endometriosis.
80%.
We have an
serious
answer, right? Yeah, that this is not unexplained anymore. We have an answer we did not look for until you failed IVF 10, 20, 50, however many times.
Yeah.
And like that breaks my heart for them. So I want to just say that and say that if you have a feeling or a hankering or an interest in being tested for it, advocate for yourself, because there are people that want to listen and there are providers that do care and that do look for it. Now, I say all of this because right now the standard of care is to do laparoscopy, which is an exploratory surgery. It makes sense. Obviously, we're not lining up every female to get that done. I recognize that. I get that. But that's like the standard of care. Like we literally go in, we look for it, and that's how we biopsy and we diagnose it. There is some newer procedures that take a uterine biopsy. So it's less invasive, not no invasion, but less invasive. We actually can test for something called BCL6. So there's a test called Receptiva Diagnostics, or DX, that tests for this BCL6, which is kind of an inflammatory marker, if you will, for simplicity. This has been shown to be present in roughly 90-ish% of patients with endometriosis. So it's a less invasive way of looking for it. And it also can tell us how likely they are to have success with like embryo transfers and those sorts of things with IVF. So I think that's really helpful information to find. So know that there is some better testing out there. There is some blood tests looking for something called CA125, cancer antigen 125. It has some correlation to endometriosis, but not perfect, meaning some people that have endometriosis still don't have that high CA125, but it's something that can be looked at. So I think it's important to mention also. And then when we have that information, generally we're working with a reproductive endocrinologist. So we've kind of surpassed maybe what our OB can do for us, and we're on to the specialist. Now they will discuss some options with you. Sometimes there is treatment and surgery, meaning they actually will go in and will remove that endometriosis tissue. And for anyone who may not know, endometriosis is when the endometrium, just meaning the inner part of our uterine lining, is elsewhere, just meaning outside. A lot of times, most commonly, it's around the ovaries. It might be around the bladder, the colon. It's been found as high up as like the lungs, for example. So it can be anywhere in the body. And of course, that can, as you can imagine, cause some inflammation because it can be hormonally active, just as our endometrial lining is. So surgery can be a good option. And there has been some great outcomes of once that tissue is removed that people can have healthy pregnancies. So I think having the information is like step one, and then talking through surgery is an option.
Surgery is an option.
Surgery can be an option, yes. And then other options can be like augmented cycles, just meaning we suppress your hormone production and then we give you hormones to kind of help mimic what a cycle would look like. And that can be successful too. So it's just having the information.
So you can get pregnant with endometriosis. This is not...
You can, yes. The severity of it and the amount of like scar tissue and inflammation are all factors. And there are a population of women with endometriosis that are actually asymptomatic, meaning they don't have a lot of intense pain or cramping. And that's part of why it can be this unexplained category, because they're not presenting as like this, oh my God, my cycle is a 10 out of 10 pain whenever I bleed, for example. And so I recognize that, but that's why I just wanted to mention there is some other testing that you can pursue and look for. And then based on that, know that you have some options of things to pursue after.
Okay, this next question. I have heard that royal jelly can improve fertility. Is that true?
It is. So right now, a lot of our research is based on animal studies, which is where a lot of it begins, but I don't want to diminish the results that we're seeing because I think it's really amazing. There's one study in particular that like pays rent in my brain, or lives rent-free, I guess is the saying in my brain, in that it was an animal study and they looked at giving royal jelly to these animals, and what they saw was a significantly increase amount of what we call folliculogenesis, so development of ovarian follicles. And again, that's the fluid-filled sac that houses an egg that will hopefully ovulate mid-cycle. And previously, they were determined to be premature ovarian failure insufficiency, or POI as we call it. So the fact that we could give something to them that actually could promote the development of follicles and kind of help them regain their fertility, if you will, I think is amazing.
So these animals that they were running the test on were deemed infertile.
Yes.
Or they had ovarian failure.
Yes, exactly.
And royal jelly actually helped resuscitate their ovaries essentially so they could get pregnant?
Yeah.
Okay.
Amazing. And we're seeing similar but really incredible research in men as well, as much as, of course, this is for the girls. I want to highlight that also for the men, royal jelly is incredible in helping with sperm motility, so the movement of sperm morphology, so ensuring it's the right size, shape, and structure so it can get to its destination. It's been shown that it can actually help with testosterone production, which I think is amazing, and can help reduce inflammation. And as the testes are outside of the body because they're so temperature sensitive, but of course there's gonna be times when they're warmer than they should be and there'll be some inflammation. So having something on board that can kind of help combat that automatically is incredible.
Amazing. I spoke about it on an earlier episode, but royal jelly has been a big part of both my fertility journey and my partner's. We're big fans, obviously. Okay. This is a question that you and I both obsess over in our personal lives.
Oh no.
Should I be worried about microplastics?
Oh no. Microplastics are technically fragments of plastic that are less than 5 millimeters in size. Nanoplastics are slightly smaller, 1 micrometer generally. And to be totally honest, they're the ones that we should worry a little bit more about, is actually nanoplastics. We're really in the infancy of our understanding of the impact that these are going to have on our bodies long term. And the reason for this, we just haven't really been looking. Plastic has become pretty ubiquitous in our world in that it's in the lining of our cups of our coffee to-go containers, it's in our food storage containers, it's in our water bottles if they're plastic. It really can be everywhere and anywhere. And so if that's present in our environment, of course, it's going to be ingested into our system. And so what I think about when I talk to my patients is, what are ways that we can minimize your exposure? Because we do know that these plastics right now can be harmful to our health. We are still figuring out the degree of that and the severity of that, but we do know that they are certainly not helpful. They can cause inflammation, they can cause immune system disruption, they can impair our ability to ovulate, ovarian function. They can accumulate in follicular fluid. So we actually had a study, I think it came out earlier this year or later last year, that confirmed the presence of microplastics in ovarian follicular fluid. So quite literally in the cells that help harbor the growth of an egg. So like we are getting them in our system, they are accumulating. And that will only continue as the world progresses because plastics are cheap and again, just ubiquitous in nature. So what I aim for is we can't get away from them completely. Like we just can't. As much as we try, it just won't happen. Top 3 things that you can do that can have an impact is stop drinking out of plastic water bottles, period. Stop, get glass, and or best case at home, if you can, reverse osmosis filter, whether it's like built-in system or countertop. Second, stop using nonstick pans. They are covered and coated in plastic and endocrine disrupting chemicals. Please stop using them. Use stainless steel and or cast iron. And then third would be stop getting your coffee that's hot in to-go containers and bring
kryptonite.
a tumbler with you.
Yeah.
Or get cold. If you're traveling and you're out, opt for cold. That heat combo with the plastic just further kind of degrades it into the liquid, and then you're just consuming a lot more of it. So to any degree that you can minimize those, and just like that goes for heating things up in plastic as well. Like, please stop, bring a plate to work, be that cool kid where like you literally have a plate in your backpack. If you're like, I can't afford to change all of my storage containers, okay, don't put hot things in there ideally, don't reheat in that, bring a plate, put it on that, or switch to glass.
You know, a big thing, I use glass Tupperware.
Yeah.
Something else that, again, we are in the early days of understanding this, but I take a sulforaphane supplement. There's evidence suggesting that can help with microplastic exposure. There are some other things, but really it's lifestyle stuff.
Totally.
Yeah.
If we can minimize burdens in other areas to our liver, meaning like minimizing alcohol, smoking, eating balanced foods, sleeping, like all of those things will help your system manage it to the best of its ability. And we say all this because like I don't want to stress people out. Like, it is ubiquitous. We are all exposed. It's just being mindful of like, okay, are there ways that we can minimize that exposure? Because it can have a positive impact for you and for baby.
Should I be worried about flying and traveling while pregnant?
Great question.
This was a big one for me because it's a requirement for my job, and I had to.
Right. Yeah, you traveled a ton. So the short answer is no, to be totally honest. What we measure and what we're worried about is just the radiation exposure when we're flying. And we can measure this, and I believe the term is millisievert. And what we want during a 40-week gestation or during pregnancy is less than 1 millisievert. We'll call it MS for short. And when we're flying, I did the math on this so that we don't have to, because head math is hard. When we fly, let's say a 5-hour flight, it equates to 0.025 millisievert. And again, our goal is less than 1, which means you would have to take 40 5-hour flights to meet that limit. So if you're someone that's hitting that or think you might exceed that, then potentially have this conversation with your healthcare provider of like, hey, are there things I should be worried about? Are there things I could be taking to help minimize this risk? This is more pertinent, I think, for individuals who travel for a living
or exactly.
Yes, that's what I was trying to say. A flight attendant, a pilot, because that, of course, means they're spending more time in the air. But all in all, no is the answer. And we compare that radiation exposure to that of an X-ray, for example, and it's insignificant in comparison to that one X-ray.
Okay, that's very good to know. I am so constipated while pregnant. I was too. What do you suggest?
Yes, not uncommon. Biggest things are, of course, the basics of like being nice and hydrated is like number one, especially if we're more nauseous, especially if we're actually vomiting, we're losing water. And so that can cause more dehydration. So super diligent about water intake, adding in electrolytes if you've deemed safe with your OB, and then also being diligent about fiber intake. As females, and especially while pregnant, at a minimum, we need 25 grams of fiber a day. This can be from like fruits, veggies, like nuts, seeds, whole grains, those sorts of foods. But aside from that, you can also have a conversation with your doctor about whether magnesium supplementation would be helpful for you. There are some kind of types of laxatives that we shy away from in pregnancy because we don't want anything, what I like to call too cathartic, just meaning like too strong. So we don't really want to like fully aggressively evacuate the bowels, but we want things moving because that's your body trying to get rid of gunk and toxins. So if it's sitting there, it's just going to get reabsorbed and it's going to recirculate. So getting things moving is super helpful. And just movement itself, like exercise, can also be helpful too.
And I just want to say, I have to be in really bad form to take something that's not natural.
Yeah.
And I got there in my pregnancy. I had to take Colace, and I took Colace pretty frequently. It was kind of my only
you needed to
option.
go.
Yeah,
right.
It's either that or not go at all, which is not good for your body.
And it's like that's where we have to weigh like the benefits and the risks of like this needs to happen and these things need to get better, and we can balance those things out totally.
Should I be worried about my skincare routine while pregnant?
Yes, because especially if we're using like a retinol, a vitamin A derivative that is known to be what we call teratogenic, which just means it can be harmful to the fetus. So yes, absolutely. And that's also where things like Accutane are super pertinent. I think they're pretty aggressive and straightforward now. If you're on Accutane, it's a no time for conception period of time. But just to highlight why the vitamin A or vitamin A derivatives can be really hard on baby, it can cause malformations and or just loss of pregnancy.
But also fragrances.
Totally.
These are like all of these endocrine disruptors.
Yes, and that's the other piece is a lot of the products that we're using, people don't realize skin is our biggest organ. It does absorb what we put on top of it, and it can disrupt how things are working and how things are functioning in our body. And they can impact how our hormones are functioning and then therefore impact how baby is growing. So being mindful of avoiding things that have any sort of scent or perfume or fragrance, because fragrance is a way that they can hide some of those endocrine disrupting things. And I think you use different apps to kind of track your personal care products, but there's different ones like the EWG has one. There's also a certification called Made Safe. That's kind of a newer one on the market that also accounts for a lot of toxic products and is supposed to be like safe for pregnancy in particular.
Okay, this next one, possibly sent in by my husband using a burner account. Is it true that doggy style gives you a boy and missionary gives you a girl?
If it helps him sleep at night, yes.
Really?
No.
I was like, oh my God.
There is no research or evidence to back that up, unfortunately, for him and his burner account. The position that we're in during intercourse does not have an impact on whether we're going to get a boy or a girl.
Good to know. Fabrics and pregnancy. I know fabrics today have a lot of phthalates, BPAs, microplastics. Yes. When pregnant, should we, and this is a hard thing to do generally, but should we be opting for clean fabrics?
Ideally, yes. And what I think is interesting too is we recognize the need to do these things while pregnant, but then we don't always recognize the need to like continue it before or after. So it's like there's this idea in society that like, oh yeah, while pregnant, we should be mindful of all these things. But then when we're not, it's kind of like, So it's like if you can follow that same trajectory throughout your life, your overall health is going to be so much better. So yes, I do think it's important that you're mindful, kind of like the skincare products. What are we putting on our skin? And that includes clothing that's covering our skin all day and the transfer of products and things from the clothing that could be in the fabric softener and the wash. So absolutely. That's another thing that I like the Made Safe for, just a different certification that is thought to be more pregnancy safe because it's looking for things like the microplastics, the phthalates, the forever chemicals that can be endocrine disrupting.
And for everyone listening, I love Mate the Label. Also a mama founder. So,
amazing.
Yeah, really
we love
their products. Okay, next question. Can I not get pregnant if I have PCOS?
I think that's probably one of the bigger misconceptions with PCOS. And part of that is because with PCOS, yes, sometimes we're not ovulating regularly. And if we're not releasing that egg and ovulating, then we're going to have, of course, difficulty conceiving. However, if we can get you ovulating, then you can have a nice, happy, healthy pregnancy and baby. Kind of goes back to one of the earlier questions that we got. So no, just because we have PCOS does not mean that we can't get pregnant. I'm sorry if anyone in your healthcare life told you that. They were incorrect in saying so. There's lots that we can do to help support healthy hormones as well as healthy pregnancy in people with PCOS.
Last question, how should I think about protein intake while pregnant?
You should ideally continue to prioritize it, hopefully just as you did in the preconception
you need more
time.
Protein while you're pregnant though?
The standard of care would say no. They would say weirdly 71 grams or 73 grams, I think is their number of what you should be getting a day. But in my mind, yes, like we're using it as building blocks, right? Protein is the building block that we use for muscle mass, for our nerve development, brain development, like so on and so forth. So protein is, one of the biggest resource fuels that gets taken from us. And so us eating more of it just makes it more available for baby. So I would say continue to prioritize protein unless your doctor, for whatever reason, has told you to be cautious or to hold off on that if there's issues with like chronic kidney disease. But if not, then prioritize protein with each meal, with each snack. The higher proteins can help stabilize blood sugar throughout pregnancy, lowering risk of gestational diabetes as well. So being mindful of that. I like to tell patients aim for 30 grams of protein with each meal. So we're at least getting 90 grams throughout the day. And then where we can fit in extra, amazing.
This was so great. I feel like we need to do a whole other one of these. For everyone listening, if you have other questions, Dr. Melissa Clark is an incredible member of our medical advisory board at Beekeepers. So you can write in questions. We will figure out how to get you answers.
Yes.
Thank you for this. I hope this is really helpful for anyone who's wanting to start a family.
Thank you for just creating the space for us to do this. I think these are conversations that we need to be hearing more of. And I just love the opportunity to sit down with you. Obviously, a close friend, but just having you as my patient's been amazing. And being able to really dive into the research and the science behind some of the things that we hear out there, I'm hopeful will give people the tools that they need so that they can get the answers that they're looking for from their healthcare providers, or find new ones if they're being met with kind of like a dead end when they know that there's probably more to investigate. And I want people to know that there is answers out there for you, and there are people who want to help you get those answers. I've loved so much doing this podcast with you and sitting down with these episodes. It's been honestly healing for me. I haven't shared my story like we did here. And going from being told in my early 20s that I'm infertile, I likely won't have children, I have this premature ovarian insufficiency, and then door was closed. It was kind of like figure it out on your own. I've spent what is now my career figuring out and finding answers because no one gave them to me. And there wasn't resources like this to have them and to find them. And so being able to like full circle moment, sit here with you and be like, hey, I've been there. I've been on that side of the phone too. And it sucks. It hurts so much to be told, hey, the one thing society tells you should always be able to do, you likely can't. Door closed, move on. And now I've made it my absolute mission in life to help women not have that same experience. And you are a testament to that. And you are just creating the space where we can have the conversations that we always needed to have, but no one was having. And so I hope that what was really a tough time for me creates and sheds light for so many other women to get the answers that maybe are just around the corner, but they didn't know where to go or who to ask. So thank you for just creating this space. Again, it's been healing for me to just share. It's like this weight's lifted off my chest, and that's felt so beautiful. And I'm hopeful and so excited to share the continuation of my journey because just like you said, I'm tenacious. I did not and will not take no for an answer. We'll fight till the ends of the earth for it. And I'm so excited.
Thank you so much for sharing your journey, your experience, all of the incredible information. And for everyone listening, I hope this was helpful. If you have other questions, Dr. Melissa Clark is a member of our Beekeepers Naturals Medical Advisory Board. She's incredible and so supportive, and we are available to you guys. So please reach out with any other questions. And Melissa, thank you so much for this. Really, I can't thank you enough.
One more thing.
Yeah.
Really quick. I'm pregnant.
Oh my God. Oh my gosh. Oh, that's amazing.
I wanted to share it with you. It's obviously super early, but I wanted to share because I feel like it would be an amazing end to the story of just like, I was told no, and I made it a yes. So I'm doing everything to keep baby in.
Oh my God. Wow. Okay, so for everyone listening, you are such an inspiration. And this is just a testament to keeping that hope, not saying no. I don't like it. Oh my God.